Trish, and I've heard so many stories about dermal fillers, and I'm not sure which ones are true and which ones are just rumors that are out to scare us. So today, I'm on a mission to clarify my doubts about fillers. It is a privilege to have Dr. Terence Tan from Halley Medical Aesthetics to help us clear some of our doubts today. Hello, Dr. Tan.
Hello. Hi, everybody. Hi, Trish. Nice to see you again.
Nice to see you again. So, Doctor, can you tell us more about dermal fillers?
Yeah, of course. Dermal fillers are very, very popular. There are various materials which can be injected into the skin to enhance the face. Now, they can actually be generally classified into two broad areas. The first one is actually for facial enhancement. Now, we use fillers to give the face a little bit more 3D projection to make the face a little bit more interesting. We can put it over the nose, the under eye area, and the chin, the cheeks, and other areas in order to give the face a little bit more enhancement, to give it a little bit more of that interesting tinge to it, in order to sculpt the face, to make it a little bit more V-shaped and a little bit more pleasing to the eye. The other broad area that we can use is actually for anti-aging. Now, we can use fillers to plump up saggy skin, to fill up wrinkles caused by loss of collagen due to age or excessive sun exposure. So we have a lot of different fillers that we can use, but which one do we choose? Well, some fillers actually fill up due to the filler itself, whereas other fillers fill up by stimulating collagen to re-volumize the face. Now, let's say if you are a little bit of a type A personality and you want results which are faster, you would choose a filler like hyaluronic acid, which fills up by itself. Whereas if you are a little bit more of a type B personality and don't mind waiting for a while for collagen to be stimulated, then collagen stimulators like Sculptra give a very natural and long-lasting effect. So the filler that we use would depend on, number one, the location that we use it on, and number two, the preference of the patient.
Okay, so before we move on to the myths, can I just ask something? After the fillers are injected, do they actually sit on our bones or is it just under our skin?
The answer is both. The location that we inject depends on three main factors. Number one, the location that we are injecting. Number two, the filler that we use, how hard or how soft it is, and also the condition of the patient's skin. So if the patient's skin is a little bit more loose, then we try to use something a little bit softer for a more natural look.
I see.
But I think really the more important thing is what technique is being used to apply the filler. More and more doctors are moving away from needles to use cannula. A cannula is actually a blunt, flexible wire that can be used to apply the filler. Now it's got various advantages to using a cannula. It gives a natural feel, but has got a lower chance of complications and also lower chance of bleeding. So that's good, and more doctors are using it nowadays.
Doctor, I've actually heard some stories about some nose fillers. Like some of them actually move to the sides and makes the nose look bigger than the original size. So is that true? Can that happen? And if it does, how can we prevent it from happening?
That can infrequently happen, but it is actually pretty rare. It happens most of the time due to excessive use of fillers on the nose, and also using a filler which is not appropriate for the nose. So that really shouldn't happen all that often. Certain fillers, maybe like radiase, they give a very sharp effect, and therefore they have actually very, very little propensity to migrate. Moreover, if maybe if a filler like a hyaluronic acid filler were to migrate in the infrequent circumstance, then there is actually a medicine that we can inject to dissolve the filler to restore the nice, sharp, enhanced look.
So my next question is, I think as we all know, fillers are only temporary. So some says that they only last for a few months. So how long do fillers actually last?
Okay, so fillers can actually last between maybe just a few months to several years, with most lasting between maybe about 1 to 2 years. And this is actually a good thing, not a bad thing, because fillers, which last a long time, might not be appropriate for some faces, because faces tend to sag with time or change with time, and faces of different ages require fillers at different areas for maximum effect or for the best effect. And therefore, refreshing the filler from time to time is actually a good thing, not really a bad thing.
Okay. So I have a very big concern. Some of my friends actually say that when you put fillers repeatedly, our body will not be able to release the toxin. Is that true?
That's definitely not true. Maybe certain fillers like hyaluronic acid fillers. Hyaluronic acid is actually found naturally in skin. It is actually responsible for plumping up that skin to give it more moisture. And on any given day, new hyaluronic acid is being produced, whereas old hyaluronic acid is being broken down. So whether the hyaluronic acid is natural to the skin or injected by the doctor, it would be broken down into metabolites and excreted completely from the body. So to say that fillers are toxic is definitely not true.
Okay, that's very good to know. So when you inject the fillers into your skin, the skin will actually stretch, right? So over time, if you keep putting fillers and the effect actually wears off, will your skin be saggy after that?
That is again a myth, and it's really not true. Generally, when we enhance the face, we really don't want to overdo it. So typically, we use maybe between 1 to 3 mils of filler, and that's really insignificant as compared to the volume of the whole face. And actually, in terms of sagginess, I think by and large, the most important factor is collagen loss due to aging and sun damage. So the best thing that you can do is actually to put on a lot of sunblock, whether you go out or not, and to avoid excessive sun exposure. Not really the amount of filler that you're using.
Okay. So I've actually heard of one case where the person went for nose filler and the person turned blind. So is that common, or how can we prevent that from happening?
Okay. Well, that can very, very rarely happen. But I must stress again, it's really, really very, very rare. Now that can rarely happen if the filler is inadvertently injected into a blood vessel. Now, therefore, if you remember what I said about a cannula earlier, using of cannula actually reduces this risk. Because the cannula is blunt, it avoids actually damage to the blood vessel. The second thing is that the person injecting the filler needs to have a very good knowledge of facial anatomy, where all the important blood vessels are, in order to avoid the danger areas in the face when injecting.
Okay.
So therefore, the answer to the question is yes, cases have been reported, but it's really, really rare. And we do our best to make this occurrence even more rare by choosing the correct technique and having a good knowledge of the face.
Okay. Alright. Okay, thank you Dr. Tan for patiently answering all of our questions. I'm sure all of our doubts have been clarified, and this Q&A session will actually help those people who are planning to get fillers to do more research and to clarify any of the myths that they have heard. So thank you Dr. Tan.
Thanks Trish, and thanks for inviting me to this nice place.